researcher at the Faculty of Medicine of Fez from the University Sidi Mohamed bin Abdillah in Morocco. First of all, I would like to thank you very much for giving me this opportunity to participate to this very interesting event and to share with you some results about this study, where we have asked some questions such this one you have in this slide. Are Mediterranean diet adherence and obesity associated to COPD? And I will show some maybe answers to this question. First of all, chronic obstructive pulmonary disease, as maybe all of you or some of you know, is the third leading cause of death worldwide, causing more than 3 million deaths in 2019. And nearly 90 years of age, effective strategies for prevention and control are not always implemented and accessible. Environmental exposure to tobacco smoke, indoor air pollution, and occupational dust, fumes, and chemicals are the important and the main risk factor of this disease. Obesity, in addition to these main factors, obesity and diet appear to play roles in its physiopathology, and the association between obesity and improvements in outcomes in patients with COPD would seem to contrast its protective effects on survival. This phenomenon known as the obesity paradox, and the reasons for these protective effects of obesity have been extremely difficult to elucidate. On the other hand, some epidemiological studies have already documented a relationship between dietary intake and the maintenance of lung function and prevention of COPD. However, studies about the role of both obesity and diet taken together are rare, and results are sometimes controversial. Hence, general population studies and development of standardized methods can be used in all countries, regardless of the income levels of its inhabitants are needed. That's why we propose this study, and we have conducted this study with the objective to describe the association between Mediterranean diet adherence and obesity and COPD among Moroccan adults aged 40 years old and above. To answer this objective, and of course others, we have participated to an international project called the Burden of Obstructive Lung Disease. And it was designed to quantify the prevalence of obstructive lung disease and to identify its risk factors across several regions in the world. This international study was later extended to cover more than 40 sites, mostly in low and middle income countries. And Morocco was one of these countries that joined these projects since 2017. So we have integrated this study, especially the city of Fez, which is the second largest city in the country, and it's located to the northwest of Morocco and counts more than 1 million of population according to 2014 census. This study was a cross-sectional population-based study conducted mainly in the 6 districts, and the target population is the adults aged 40 years old and above, bedridden patients and people with mental illness were ineligible. And the multi-stage cluster sampling technique was used to select the 600 needed subjects And this number was rounded to 900 to compensate for problems of refusal or absence. All participants were asked to complete the bold core questionnaire, which was the main questionnaire in this study, and it includes respiratory symptoms, exposure to potential risk factors, comorbidities, healthcare utilization, medication use, activity limitation, cigarettes, smokers, etc. It's also included the SF12 to assess the overall health status. Participants were also asked to fill in the occupational and biomass questionnaires, and there was also a minimal data or refusal questionnaire for participants who were not willing to participate in the full protocol. So for dietary data, they were collected through a validated food frequency questionnaire, which is a Moroccan version, which include more than 250 items grouped into 32 food groups, which was the basis of the Mediterranean diet score calculation. All used questionnaires in this study were translated to the local language, which is Darija, and back translated to English. These individuals were also asked to provide measurements of lung function before and after administration of a short-acting bronchodilator using the spirometer NDD EZ1, which meets predetermined performance criteria, which are reliability of measurements, possibility of use in the field, and the ease of access to data. Method selected for the bold protocol meets or even exceed ATS standards for equipment and technique. In addition, anthropometric measurements such as waist circumference and body mass index were performed using also standardized guidelines. Appropriate training has been run for spirometry technicians and also for investigators, and for quality control. All implicated persons in this study were certified. The home survey was carried out between 2010 and 2014. All participants gave their written consents to answer the confidentiality. Data were anonymously transferred to central database. Names and personal information were replaced with IDs, and the study has been approved by the ethical committee. So for statistical analysis, the COPD status was defined according to the American Thoracic Society, and VMS to CVF value less than 70% indicates the COPD subject to be stage 1 and above, and non-COPD subject would have VMS to CVF more than 0.70. Measurements of the BMI were taken according to the WHO guidelines and categorized into 4 groups, namely underweight, normal weight, overweight, and obese. And the waist circumference values, they were categorized into 2 groups, normal waist circumference and abdominal obesity, of course, in men and in women. Adherence to the Mediterranean diet food was assessed by calculating the Mediterranean diet scores, including 8 food components, which are cereals, olive oil, fruits and nuts, legumes, vegetables, fish, meats, and dairy products. We have excluded the alcohol consumption from these items because of some religious and cultural considerations. And for the included items, value of 0 or 1 has been assigned to each of these 8 components and the 8 indicate components according to their beneficial or deleterious effects on health. And the scores for each food components were then added together to obtain a total Mediterranean diet score ranging from 0, which means minimal adherence, to 8, which means maximum adherence. And at the end, this Mediterranean diet score was divided into two groups, the low category from 1 to 4 score, and high category from 5 to 8. The main results of this study were as follow. For general socio-demographic characteristic of the sample of Moroccan population, the mean age was 55. The 54% were female. Nearly all women declared that they have never smoked, while 21% of men were current smokers, and most of the population was illiterate. And the mean BMI in the study population was almost 28 kilogram per meter square, and the prevalence of COPD was estimated at 14%. Now, when comparing general socio-demographic characteristic of the sample according to gender, female were older than male, and more than 2/3 of them were illiterate. However, they were mostly non-smokers compared to men who were younger, and more than half of them were either smokers or ex-smokers. And the overall prevalence of COPD was significantly higher in men than in women. The comparison of the prevalence of spirometry-based COPD according to socio-demographic parameters, this prevalence increased with age from 7% for 49 years to 29% for 70 years and above, and with smoking status from 11% among never smokers, 18% for former smokers, and 24% for current smokers. The same result for age was observed when the analysis was run separately in men and in women, but has disappeared for smoking status in men. In addition, COPD prevalence decreased significantly with the educational level only in men. Results about anthropometric measurements showed that higher prevalence of obesity was observed in women compared to men. However, the prevalence of overweight was higher in men than in women, whereas a higher prevalence of waist circumference, abdominal obesity, and higher prevalence of waist to hip ratio, abdominal obesity, respectively, was observed in men compared to women. The comparison of prevalence of COPD according to anthropometric measurements showed that overall COPD prevalence decreased with increased BMI from 25% for underweight to 10% for obesity, and with waist circumference from 20% for normal waist circumference to 10% for abdominal obesity. And the same trends were observed in women for BMI, were observed for BMI from 40% in underweight to almost 9% in obesity, and for waist circumference in normal waist circumference to from 30% in normal waist circumference to 7% in abdominal obesity. Conversely, this association was not significant in men. For both genders, the prevalence of COPD was not associated neither with the level of educational level nor with the waist to hip ratio. Another result, the age, educational level, and the total energy intake adjusted logistic regression analysis showed a significant independent association between the decreasing of the risk of COPD with overweight, and here you can see, and also with the waist circumference abdominal obesity in the whole population. However, and the same result was observed here and remains significant in men for overweight and for waist circumference abdominal obesity. However, all these associations that we have observed in both women and in the whole population has disappeared for men. With regard to a Mediterranean diet score, waist circumference abdominal obesity were more frequent in low Mediterranean diet score group than in the high Mediterranean diet score group. And COPD was more prevalent in the group of subjects with high Mediterranean diet score than those with the low Mediterranean diet score group. And this table shows the results of the adjusted binary regression analysis for the association between dietary Mediterranean score or adherence categories and COPD risk, taking into account abdominal obesity. So no significant association has been observed between these Mediterranean diet score categories and COPD risk, neither in the whole population nor separately in each gender group. However, significant associations were found between specific components of the Mediterranean diet score and COPD in the whole population, and each of the Mediterranean diet adherence categories. Overall, and regardless of age, of sex, of smoking habits, abdominal obesity, as well as total energy intake, there was a significant, statistically significant inverse association between the individual components of the Mediterranean diet score and COPD risk for cereals, fruits, nuts, and vegetables, while positive association with dairy products was observed. In addition, the risk of COPD decreased in men for olive oil and legumes and increased for meats. In contrast, these components were not associated with COPD risk in women. In conclusion, when studying, and if we want to sum up with all these results, we can say that when studying only BMI categories and waist circumference abdominal obesity, COPD risk decreased with overweight, with obesity, and also with WC waist circumference abdominal obesity in the whole population. And the same result was observed in men for only overweight and for waist circumference abdominal obesity, but not for obesity. None of these association remains significant, however, for men. When now studying at the same time BMI categories, waist circumference, abdominal obesity, and Mediterranean diet score, all their association with COPD risk have been disappeared. However, significant association were observed between specific components of the Mediterranean diet score and COPD risk, regardless the waist circumference abdominal obesity status. These results are in concordance with the some published literature, and they suggest to take into account the components of the diet instead of the whole diet. Longitudinal studies focusing on both obesity and diet are needed to better understand their interaction and to suggest more effective intervention to reduce the COPD risk. Thank you very much for your attention.
Thank you, Dr. Karima, for your excellent presentation. Actually, is very benefits for all, and for especially is related to the obesity, because nowadays